Well, good afternoon. I am joining the brief today with Dr. Morrison, as we are in position today to release the details of our phased-in approach to begin cautiously and carefully relaxing COVID-19 public health restrictions in our province. We're calling it Renew PEI Together. In a moment, Dr. Morrison will outline the incredible amount of work and input that has gone into the formulation of this document, how we have gotten to this point in time, so that we can begin to make the long and winding road back from and to some kind of normal. In addition, as she has every other day, she will outline the status of the virus in this province. To date, Prince Edward Island has met the challenges head-on of COVID-19. We have acted very quickly and responsibly. Government has acted swiftly and effectively, and islanders have been accountable. In a very short time, we have learned to change our behaviors, and this has been an incredible undertaking and an incredible effort by all islanders, and the big reason as to why we are in the current position that we enjoy. When you look across the country and around the world, there's little doubt that we are in a very good position. But though we enjoy that current position, it is not something that we can take for granted. It would be irresponsible and wrong for anyone to suggest that we are done. We are a long, long way from being done. The plan which we will release today and which will help guide us through the immediate future has been carefully constructed. It is built on some basic fundamentals, the first being that we remain in a worldwide health pandemic, fighting a virus that we're still learning a lot about, with no vaccine in sight, a virus that moves quickly and indiscriminately, and has throughout this region, country, and the world made people very, very sick and has killed thousands. The plan is based on the best efforts to ease back, which we long desire, from the past several weeks of being isolated, separated, from being essentially locked down. But we still need to minimize contact, to limit the spread of the virus, to minimize serious illness and death. We need to be cautious, we need to be careful, and we need to be methodical. That is why we will proceed with a gradual phased-in approach that will be constantly evaluated based on the best public health information we have. We know, Dr. Morrison and I, know this plan will be met with much discussion. As your Premier and in daily conversations with Dr. Morrison and those in her office, I know, as she does, that many islanders have many different views and opinions as to how we should move forward. We are trying to make the very best decisions that we can make to begin the process to get daily life and business on the road back. We know that the plan will never be fast enough for some. We know that the plan will never be cautious or slow enough for some. And we know that we cannot and we must not try to make everyone happy. But as we have said repeatedly in here, we have to do everything that we can to make people healthy and to keep people healthy. We have to look at it from this perspective. If we were to err by waiting an extra week or two to open up the economy, and that impacts that it would have on businesses or individuals or NGOs, we have the ability to help, as we have demonstrated, to those who would be impacted. We can use or create programs and funding vehicles to help those impacted, to help them come back. But if we err by moving too fast, opening too soon, making our province vulnerable to the spread of the virus, people could get really, really sick or die. And there are no programs to bring people back from the dead. So we will begin this long road back, but we will do so with extreme caution. We will keep intact the strict screening processes that we have in place at our points of entry. We have ramped up our capacity to test. We will remain focused on keeping our vulnerable populations protected, such as those in our long-term care facilities. As we ease back into some kind of more regular routine, we need to remember that this isn't business as usual. We will need to continue to rely upon the responsibility and accountability of islanders. We will need to continue to follow social distancing, practice regular hand washing, disinfecting of commonly touched areas, practicing good hygiene, staying home when we're ill, all of the things that we have been doing to date. The collective action that we have taken, this has gotten us to this point, and it must continue. From day one until now, we have learned a lot. Some of these lessons that we have learned have been very hard learned, but we are better for it. We must not forget what we have learned, and we should have no interest in trying to relearn it. As a wise man once told me, there is absolutely no education to be gained from the second kick of a mule. So as we move forward, let's continue to the approach that we have taken to date. We have followed closely the advice and health directives of Dr. Morrison and the Public Health Office. That must continue. Islanders have been acting in the best interests of one another. That must continue. Islanders have been patient and have undergone the dramatic altering of their lives, and that must continue. As we have from the beginning, I say to all Islanders today, let's stay strong, patient, vigilant, and united. That approach has gotten us this far, and it will get us through to the end of this if we keep working together. So with that, I will pass it on to Dr. Morrison and just say that the document that she will outline later today, right here, is something that has been developed under incredible circumstances. Not only have they been working to create this document, but they have continued to lead our fight against COVID and the spread of the virus. So on behalf of all Islanders, I thank you and your staff for what you have done to date. So over to you, Heather.
Thank you, Premier. Good afternoon. Before I get into speaking more about the Renew P.E.I. Together document, I have to announce a new case of COVID-19 for Prince Edward Island, bringing our total to 27. And this is our first case since April 15th. This case is an individual who is a man in his 50s, and he is self-isolating at home. And it is related to international travel. This is an important reminder that the virus has not gone away, and it's a reminder that as we discuss easing up our public health measures, it is not without risk. And it also reinforces why when we talk about easing up measures, we need to go slowly, methodically, and with care. Over the past several weeks, as the Premier has mentioned, Islanders have experienced challenging health, social, and economic circumstances. And together we have quickly changed the way we live, play, learn, and work, not only to protect ourselves, but to protect each other. And the preventative measures we have put in place have made a difference. The physical distancing, preparing our health system, our screening at the borders, the self-isolation requirements, and ongoing surveillance. Today, PEI has the second lowest number of cases per capita, no evidence of community spread, and no hospitalizations or deaths related to COVID-19. And this puts us in a position to look at cautiously relaxing some of the public health restrictions. We need and we want to get back to some level of activity. And in the past, we've talked about stay home as much as possible, and this is a transition and a move away from staying home as much as possible and slowly changing that. But it is extremely important we remain vigilant throughout this process. And because we do expect to see more cases of COVID-19, the screening at the points of entry and the self-isolation of travelers will continue to be extremely important. Today, as we announce Renew P.E.I. Together as P.E.I.'s safe, measured plan to ease public health restrictions related to COVID-19, it will be done in phases. Renew P.E.I. Together outlines the guiding principles and phased approach to reopen businesses, services, and public spaces in the province. It is a general plan implemented in 4 phases, the first of which will begin Friday, May the 1st. Each phase includes a progressive lifting of restrictions on individuals, communities, and organizations, and we'll move through each phase gradually, with each phase being evaluated and monitored by our office and our supporting team. At any point, progress could be slowed, halted, or even reversed in the interest of protecting Islanders. And it is important to understand that this phased approach does not mean business as usual. All services, businesses, and organizations will need to modify their operation in light of COVID-19 and create operational plans to demonstrate how they will reduce the risk. And many businesses and organizations have already done so or are in the process of doing so. Also, organizations and businesses are not required to reopen at any initial date for a phase, and may choose to continue operating in a manner that, and a timeline that they feel more comfortable with. Our collective action will make a success of this plan. I'd like to talk about public health guidance that will remain in place throughout every phase, and that's the first thing I'd like to mention. And I will use some slides here, if I can do that, if they work. Okay. So in terms of public guidance that is important for all phases, and I know some of us will know this, but I think it bears mentioning again. So I'm going to read some of these out. It is to maintain physical distancing of 6 feet with individuals who are not part of one's household. It is to adhere to mass gathering limits of each phase. Stay at home when ill, and call 811 if experiencing symptoms of COVID-19. Wash your hands often with soap and water or use hand sanitizer. Don't touch your face with unwashed hands. Cough or sneeze into a tissue or your sleeve and wash your hands after. Ensure enhanced cleaning and disinfection of commonly touched surfaces. With employer support, continue working from home. Continue to use online home delivery and curbside options where available. Vulnerable individuals should exercise caution and minimize exposure. Limit personal, non-essential travel. And consider wearing non-medical masks in certain situations, such as public transit. And keep a log of interactions to self-monitor and to facilitate contact tracing should a case be detected. And as I've mentioned already, for the foreseeable future, border screening will continue at points of entry, and all persons entering the province will be required to self-isolate for 14 days. Of course, there are some exceptions for essential workers in that regard. Visitor restrictions in long-term care facilities will be maintained, as well as priority public services, childcare for essential workers, and home-based learning options. And moving into phase 1 of Renew P.E.I. Together, which will begin this Friday, May the 1st. As of the end of the week, priority non-urgent healthcare services will begin, and this includes a phased approach as well. Priority elective surgeries and other priority services like cardiac supports and cancer screening. It also includes select health service providers such as physiotherapists, optometrists, and chiropractors. Where possible, other healthcare delivery will continue virtually. And on May 1st, outdoor gatherings of no more than 5 people from different households will be permitted, and physical distancing must be practiced during these gatherings. We are terming these the driveway and sidewalk visits, and I think we will look forward to those. Also, beginning May 1st, non-contact outdoor recreational activities of no more than 5 people from different households will be permitted. And this would be, for instance, my son being able to go on a bike ride with a couple of his friends. It also includes recreational fishing, golf courses, and P.E.I. residents going to their own seasonal properties within the province. There'll be select outdoor and construction services such as landscaping, road construction, watershed cleanup, and outdoor photography, again, with proper physical distancing practices in place. In phase 2, the plan would begin, of course, if all goes well, on May the 22nd. There will be limited indoor gatherings of no more than 5 people and outdoor gatherings of no more than 10 people involving those from different households. Again, maintaining physical distancing, and that should be in place. Additional non-urgent healthcare services and public services will continue. Non-contact indoor recreational activities, retail businesses, and select indoor services can open. And examples, I think this is one where everyone is interested in, would include hairdressers and barbers. And so a lot of people are very anxious about that. And it also would include having friends over to watch movies, again, with the physical distance, as long as there are no more than 5 people in the house. Unlicensed and licensed childcare centers will reopen, and home-based learning will continue with some limited activities. And then phase 3 has a potential to begin on June 12th, but does not have a firm start date officially, and then again, it will depend on the next number of weeks. But at this point, we would permit gatherings of no more than 15 people indoors at that time and 20 people outdoors, and it would include religious gatherings. The transition to increased non-urgent health services will continue. Organized recreational activities, facilities and recreational facilities and services, and public spaces would reopen. This would include a yoga studio, pools, tennis, organized tennis, for instance. And additional personal services, and then in-room dining at restaurants with reduced capacity, and there'll be further discussions and details forthcoming. Note, there are many organizations or businesses that may not be sure where they fit in these phases. And if you do not see yourself or have any questions, certainly seek direction from our office. And there will be some businesses and organizations that maybe we haven't thought of that fit in easily to one of these phases, and we wanted to talk to you and so that we can figure it out together. And finally, phase 4 is when we look ahead and take a few steps, and there's no firm date for this phase. It will include further relaxation measures as the situation permits. The COVID-19 pandemic has changed how we live, learn, work, and play, and these changes will be with us for some time. Eventually, and this is when we talk about phase 4, we will get to see your mother in long-term care. We will hug each other. We will have a chance to enjoy large gatherings and festivals and events again. I don't know when this will be, and I don't know exactly how it will look like as we get there. But we've talked about hope before, and there is hope, and I'd like to read the last 2 sentences of the document. There is hope. Prince Edward Island is resilient and full of caring, intelligent, and hardworking people. Together, we will cautiously and deliberately take these first few steps in response to the global pandemic. Renew PEI. Thank you. Je vais faire en français. Et je vais essayer de faire assez vite ici, mais bonjour, bon après-midi. Aujourd'hui, je dois vous annoncer qu'il y a un nouveau cas de COVID-19 ici à l'île du Prince-Édouard. Notre total est 27 maintenant. C'est relié à un voyage à l'extérieur du pays. C'est un homme dans ses cinquantaines et il est chez lui et il s'auto-isole. Comme je vous ai dit, on est loin de la fin. Ce cas est un rappel important à nous tous que nous devons considérer nos plans de relâchement tranquillement, petit à petit et avec beaucoup d'attention. On ne veut pas mettre à risque la province. Depuis des semaines, il y a eu de nombreuses incertitudes par rapport à la santé, à la société et nos circonstances économiques aussi. On a réussi à changer notre façon de vivre ensemble. On a adapté comment nous vivons, apprenons, travaillons, restons en contact et aussi les protections que nous avons mises en place pour tout le monde. Nous pouvons constater que nos actions ont fait une différence. La distance physique, la fermeture des écoles et des centres de petite enfance, préparer notre système de santé, les contrôles aux frontières, l'isolation après tous les voyages, la surveillance continue. Parmi nos voisins, notre province est au 2e rang du moins de cas positifs par habitant et nous n'avons ni de propagation communautaire, ni de cas aux hôpitaux et pas de morts reliés à la COVID-19. Ceci nous permet d'envisager un plan de relâchement. On doit rester vigilant à travers ce processus. Aujourd'hui, on annonce un plan et ce sera mis en place en plusieurs phases. Ce sera évalué à chaque étape et nous le ferons avec plus de tests et la surveillance qui continue. Le plan s'appelle « Renouveler l'île du Prince-Édouard ensemble » et c'est un plan provincial. Et on explique les principes qui informeront notre approche pour ouvrir les entreprises, les services et les espaces publics. La mise en marche du plan commencera vendredi, le 1er mai, et ce sera en 4 phases. Et chaque phase réduira petit à petit certaines restrictions pour les insulaires, les collectivités et les organisations. Comme je vous ai dit, on va faire ça tranquillement, petit à petit. S'il y a des inquiétudes, on pourra ralentir, changer ou même retourner aux mesures nécessaires pour protéger les insulaires. Ce relâchement n'est pas un retour à la norme et tout le monde va devoir modifier leur façon de faire et tout le monde va devoir se créer un plan opérationnel qui nous montre comment ils vont réduire le risque. Le succès de ce plan se fie à l'effort collectif de nos actions. Je ne vais pas donner tous les détails de chaque phase, mais je peux répondre aux détails ou des questions. Mais renouveler l'île est un plan général. Les entreprises et les organismes communautaires n'ont pas besoin d'ouvrir la date que nous annonçons aujourd'hui et continuer à opérer que vous êtes confortable. Et si vous avez des questions, vous pouvez contacter notre bureau. Partout dans les parties des plans, il faut respecter la distance physique avec toute personne qui n'habite pas avec vous. Cette pandémie a changé notre façon de vivre. C'est difficile de prévoir le futur, mais la phase 4 est probablement une nouvelle norme pour nous tous. On aura la chance dans le futur d'être en famille, qui sont au foyer de soins et qui sont à risque, dans un grand nombre ensemble, et de fêter ensemble et de visiter et d'être avec nos proches qui sont loin. Mais on ne sait pas la date, mais on va y arriver. Mettre en marche le plan de renouveler l'île du Prince-Édouard, on va le faire avec attention, petit à petit, et ça sera ensemble. Merci.
Merci. Thank you, Heather. I think we can now open up to questions from our friends in the Isle of Media. So, welcome.
Nicole Williams, CBC.
Hi, yes. Hello to you both. My first question is, it could be for either one of you. I see that there are details here about daycares, but not schools. What is the status of that, and why was that not included in this plan?
Hi, Nicole. There is a section on education, and I think it's we want to be clear that education is continuing, but schools will not be reopening in the same way they were, and there'll be further details. Some of the respecting our numbers in terms of gatherings. The schools are looking at what limited activities they may be able to do in that regard, and there will be further details from education forthcoming. But there will not certainly be a return to school on May the 11th. I know it was delayed until that time, but education will continue. And Premier, you may want to comment.
Yeah, I think that education will be coming up in the days ahead, outlining what they would like to try to do under the new framework that we're unveiling here. One of those things would be students who may require some additional resource from our educational assistants, for example. They might actually try to, by appointment, have some teachers meet with some students and parents for extra help, that kind of thing. But the plan is very much trying to be developed and finished off, keeping with the guidelines that are outlined in the plan from CPHO.
Thank you. And my next question is, I see that at no point in this plan do you consider lifting border restrictions. I'm wondering when you might be looking to do that.
Yeah, I mean, I think it's hard to know right now. I mean, we've only gone out so far. We know it's an important measure. We also know that both internationally and nationally, when they are talking about the criteria, it's really important to make sure your risk of importation of cases is controlled, and our risk of importation of cases is through our entry points to the island. So at this point, it is really key that we continue to do the measures that we have put in place, but we'll continuously be monitoring and evaluating what that looks like, how that could change, and when it's needed to change. We've talked about the sort of Operation Isolation. We have over 2,000 people we're calling a day at the moment with Operation Isolation. So those are people who are in Prince Edward Island now that we are calling for their that period of time, and that, of course, that number changes every day. We are doing some screening of high-risk folks as they're coming off the bridge that has started. And but those measures are really important at this point in time, and we will be able to ease up some of these measures, and we're able to do some of these easing up of public health measures because we have those points of entry control at this point in time. And so I think we'll need to see how it goes in the next few weeks.
Yeah, and I think there's been a long path to get to where we are right now, and obviously there's a longer path to get out of it. But we've kind of began this process, a number of days ago, with the very realistic understanding that points of entry and mass gatherings would be among the last to be eased. So what does that look like into July or beyond? I don't think we're able to answer that right now, but essentially what Dr. Morrison and our government has been operating under under that guidance, essentially that the greatest risk right now to Prince Edward Island is from transportation outside of the province, so we have to be very mindful at our borders, and that needs to continue.
Thank you.
Jessica Doria Brown, CBC.
Hi there. This question is for Dr. Morrison. Can you tell us a bit more about this newest case, where this person came from, any other details for point of entry?
Hi. So this person came from outside the country, international travel, and they came across the bridge, and they've been self-isolating since arrival on Prince Edward Island.
Okay.
just in terms of daycares, any more details on how they might be reopened safely with very young children who obviously don't understand or appreciate the idea or importance of social distancing? Will numbers be reduced? Any more details on how that might work?
Well, I'll give you a little bit of details, and again, I think those education and early childhood will certainly complement those and add to those. But for instance, there will be numbers restrictions on the unlicensed daycare in keeping with our maximum number, and that would include the daycare adults and children maximum. And we have worked with early childhood around some of the guidance for the daycare centers for emergency daycare centers for essential workers, and so I think there'll continue to be an ongoing discussion and working with early childhood to try to keep both the staff and the students safe. And of course, it's in one sense the young children, and we've talked about it here before, the young children in this country have not been impacted by COVID-19, not only in this country but around the world, have not been impacted by COVID-19 in the same way as, for instance, older people in the country.
And one thing, if I could just add, Heather and Jessica, is that one of the challenges that we've had in trying to develop a plan such as this, and knowing that schools won't be open to the extent they are, we know the level of population we have had in early childhood leading up till now, but getting back some kind of economic plan and to recovery with schools not being open, we know that puts extra stress on families in terms of those who would need added child care. So this is just one of the many things that we have to try to walk the fine line of as we look at reopening. And you know, you've heard us say many times we've been tackling issues we never thought we've had to tackle, doing things we never thought we'd need to do, and this is just one of the many added components of trying to work back into some kind of ease back, but knowing there are many, many challenges in the process, and this is one of the big ones.
Okay, thank you very much.
Carrie Wynn McLeod, Ocean 100.
Good afternoon. I guess my first question would be for Premier King. I'm just wondering, you mentioned about, you know, we are still vulnerable and you don't want to be opening too soon, and that there are, you know, programs that you can develop, and certainly no program, I believe it was no program to bring people back from the dead. Are you anticipating having to come up with a number of other programs for Islanders in the near future, Premier?
Well, I think, thank you, Carrie Wynn, for the question. I think one of the many aspects of this that we need to look at and would be that there are now businesses that will be coming online or have the ability to come online beginning May 22nd, for example, that will need to transition how they do things, and to make their businesses sort of COVID protected. So we would be looking at trying to develop some kind of program to assist businesses with that. We think there's an adaptation fund that we have in place that could help. We've been talking to ACOA, who might be able to come on board to help as well. But that's one of the programs where we really feel that many small businesses in PEI will need some assistance with, and it's certainly one that we're prepared to step up and help with as the days move forward. We do want the economy to try to come back on stream as safely, as cautiously as we can, and we know that there are a lot of companies that are impacted and need some help here, and as we have with every other aspect here, we feel like it's time to step up, and you'll be hearing more about that in the days ahead for sure.
Okay, thank you. For Dr. Morrison, I'm just curious, are we able to do the serology testing here to check for antibodies in people? And if not, will we be able to? And when would that start? And who would be tested?
Hi, Carrie Wynn. So the serology testing has not and basically what we're doing there is checking for immunity status. They have not been approved by Health Canada at this point in time, but it's something we'll continue to monitor. One of the issues with some of the serology and immunity tests are they're not sure that how it measures it and how well it's measuring immunity. So if they need to make sure that when they test your immunity, you actually, it will mount the protection that you need. So that's why I think we haven't seen a lot of approval of some of those serology tests yet. But it's continuing to be something that we'll monitor here, and it will be of course interest to lots of people.
Great, thank you.
Julien Le Cacheur, Radio-Canada. Julien Le Cacheur, Radio-Canada. Laurent Rigaud, La Voix acadienne.
Bonjour, docteur Morrison. J'avais une question juste pour confirmer, voir si j'ai bien compris. Vous avez dit que les rassemblements à l'intérieur vont être permis entre des personnes qui ne sont pas forcément de la même maison, petit à petit. Est-ce que si on a 5 personnes qui viennent à la maison, est-ce qu'il faut garder 2 mètres de distance entre tout le monde?
Oui, si vous avez 5 à la maison.
Oh, pardon, docteur Morrison?
Oui.
Oui, pardon, excusez-moi. Je répète ma question rapidement. Docteur Morrison, phase 1, le 1er mai, phase 2, le 22 mai, et ainsi de suite. Comment allez-vous décider le 22 mai de revenir en arrière si malheureusement la situation se dégrade, se dégénère, s'il y a de la transmission communautaire? Qu'est-ce qui va vous faire décider de revenir en arrière le 22 mai?
Alors, je vais commencer. Je pense que, Laurent, je vais répondre à Julien en premier et puis après Laurent. J'ai eu 2 questions. Mais le 22 mai, si on voit qu'il y a un grand nombre de cas communautaires, transmis communautaires, si on voit des outbreaks avec un grand nombre de personnes, et puis et c'est aussi lié à la capacité de la santé publique de contacter des personnes qui étaient en contact avec un cas. Et aussi, on regarde la capacité du système, si on a assez de lits aux hôpitaux. Alors, il y en a plusieurs facteurs. On regarde le système, on regarde le cas, les circonstances, et puis à ce moment, on fait une décision. Est-ce qu'on doit ralentir un peu? Et puis aussi, on regarde, est-ce que les gens fonctionnent et écoutent la direction, parce que sinon, ils augmentent la risque.
Mon follow-up, Dr Morrison, et après je vous laisse avec Laurent. Est-ce que la phase 4, dite retour à la normale, où on n'a pas de date, signifiera la réouverture des frontières?
On ne sait pas exactement quand on va ouvrir les frontières. Et puis, c'est difficile de dire si c'est étape 3 ou c'est étape 4. Mais parce que ça dépend aussi qu'est-ce qui se passe aux autres parties du pays, au Nouveau-Brunswick, qu'est-ce qui se passe ici. Alors, on va voir. Et puis, on n'a pas une date pour ouvrir les frontières de l'île du Prince-Édouard à ce moment.
Merci.
OK, merci. Et puis, je pense que c'est Laurent encore.
Oui.
OK, je m'excuse. Vous avez... est-ce que vous pouvez répéter la question maintenant?
Je voulais savoir, quand les rassemblements à l'intérieur seront permis, même dans la phase 3, on pourrait être plusieurs à la maison, inviter des gens. Est-ce qu'il faut garder la distance de 2 mètres avec tout le monde, même à l'intérieur?
Oui. Oui, il faut garder la distance à l'intérieur des 2 mètres. On sait que c'est une des choses qu'on doit garder pour réduire le risque de COVID-19. Et puis, c'est une des choses qu'on peut faire, une des choses qui est plus de protection que même des masques. C'est bien plus meilleur qu'un masque, de garder la distance. Alors, vous devez avoir une grande maison si vous devez avoir plein de monde et veut garder la distance.
Okay. And I just have a question for you, Premier. I'm wondering if, is there any discussion with New Brunswick, Nova Scotia, and Newfoundland and Labrador to reopen together all the province from the Atlantic?
Well, thank you for the question. I think right now the Atlantic provinces would be like every other jurisdiction. Everybody is sort of working at a different pace. The most consistent one with us right now would be New Brunswick. Nova Scotia is obviously side with dealing with the horrible tragedy from last weekend. They are dealing with COVID at a certainly different level than us, and there's been some sporadic challenges, obviously, in Newfoundland. Right now, the one most consistent with us would be New Brunswick, so if we were forecasting out the net quite a bit longer than what we deal with here, probably the best possible province to partner with at some point would be New Brunswick. We're certainly not there yet, but I would say, but of the 4 Atlantic provinces today, it would be most likely, all things being equal and staying as they are, that we would be first to work more closely with New Brunswick than the rest.
Thanks.
François-Pierre Dufault, Radio-Canada.
Good afternoon to you both. I'll ask my question in English, and I would ask Dr. Morrison if you can answer it in French, please. My question has to do with enforcement. So starting on Friday, what is the plan going forward? Are we going to see the same level of enforcement that we've seen in the last few weeks and even last few months, or is that going to ease up as the measures or the restrictions are eased up from now until late June?
Do you want me to?
Yeah, you start. And then, sure, yeah.
Okay. Hi. So I think I'll start and try to answer in English, and then I'll try in French as well. So in terms of the monitoring, a couple of things. We will be updating our public health order, and by the end of the week, so that it is consistent with these measures, and so the update of the order will be consistent with phase 1. And we'll be relying certainly on our partners to help us with some of that enforcement. But it's really about graduated approach, and it's about education and then progression from there. So we are going to have a system of, we are asking businesses, for instance, and organizations to have operational plans. There'll be a certain number which will be inspected and randomly inspected. There'll be some that we will identify and work with businesses and organizations if they want to have questions about their plans, and we'll be issuing some clear guidance be general guidance. We and that process around the monitoring is being finalized, but that's certainly the broad strokes of what we are intending to do from that point of view. Did you want to add anything?
Well, I would just say that the other aspect of this that has helped get us to where we are right now is the fact of the buy-in and the accountability of islanders, island businesses, how we have transformed our lives and taken it very, very seriously, the health directive. So in many regards, we have been policing ourselves on this and doing a really, really good job. I know when the few times that I've been able to go to closed store, they're limiting the amount of people that go in there. They're giving you hand sanitizer. And these businesses have really taken a leadership role in this, and that helps in our enforcement. And that accountability of islanders and island businesses gets us to this place, and we need to continue to rely on that as we start to roll out the first phases of our ease back.
Absolutely. I mean, some of the plans that we have seen and discussions we've already had with certain organizations have been very they've been really good, and businesses they've been impressive about how they're thinking, and they're thinking differently about how to protect their staff and their employees and the public. So in so doing, also protect their families. So I think that's been good. Alors, je vais essayer de répondre en français. Vendredi, on va changer un peu l'ordre de santé publique pour que c'est en ligne avec les changements qu'on annonce aujourd'hui. Et puis avec les inspecteurs, qu'on a Environmental Health Officers, puis la plupart du temps, normalement, ils travaillent seulement, pas seulement, mais ils font les inspections des restos. Maintenant, ils vont aussi faire les inspections des business ici. Et puis, ça va... On organise un peu comment on va le faire. On demande aux organisations d'avoir un plan, on s'appelle ça un operational plan, qu'ils organisent un peu, et puis s'ils ont des questions, on peut essayer de répondre aux questions, mais il doit avoir un plan, et puis si on les inspecte, de montrer leur plan et comment ils fonctionnent, en suivre vraiment les règles qu'on a annoncées.
Follow up, if I may, and the same concept. If you can answer the question in French as well, Dr. Morrison, that would be greatly appreciated. The measures that we've seen in grocery stores, for instance, we've seen those plastic dividers appearing between cash registers. We've seen those arrows on the floor. Is this going to stay beyond the last phase of easing up?
I just came off a call with some of the health officers across the country, and it wasn't about the plexiglass divides, but it was about another matter, and I had the same question. I mean, when we start talking about this, when are we, part of the communication is also when do we change, and how will that change? And some of it will depend, I think, on emerging evidence and evolving evidence from other countries, and what we still continue to learn about this virus. Some of it will depend on when we get a vaccine. And I think the answer is we don't know for sure what it will look like, and will everything come down, or will some of these measures, I mean, in terms of increased hand washing and making sure we don't go out when we're sick, those are good practices. And so some of those we've been talking about for a long time, and they will continue. But what some of those other additional measures and how they will change, I hope they do. Some of them change. Some of the things we're doing, I hope they stay, and some I hope we don't have to continue them. But we'll know more, I think, in the months ahead.
I would just add, Francois, before Dr. Morrison answers in French, but there's ingenuity that we find in a crisis situation like this. So I do think you will see some of the behaviors that we are undertaking now that will continue. I think more and more people now are more comfortable buying online, ordering online than they would have ever been before. I think that will continue. I think from a government operations perspective, we have a large number of people operating on a work-from-home capacity that I would think, quite honestly, 3 months ago that I don't think anyone would have thought that would have been practical or probable. So I do think there are certain ingenuities that are taking place here out of necessity that people will now continue to carry on. But like Dr. Morrison, there are many things I hope we can quickly leave behind on this. But I know one small speck of this from a government operations perspective has been me trying to talk to my colleagues in government, the ministers, the deputies, and so many others to let's not lose track of some of the ingenuity and some of the really amazing things we've been able to do to cope with this, because there's efficiencies we can take forward that will help us to keep rolling. So.
OK, je vais quand même essayer en français. Est-ce qu'on pense qu'on va changer ces pratiques dans les mois qui suivent? Il y en a certaines que j'espère qu'on va garder. On va essayer de laver les mains plusieurs fois. On va essayer de ne pas sortir si vous êtes malade. Et puis, c'est des choses qu'on doit faire quand même dans la saison de la grippe. Mais il y en a des autres choses que j'espère qu'on va pas toujours avoir tellement de distance. J'espère qu'il y a un jour, on doit toujours pas porter les masques, mais on a beaucoup, on cherche... on regarde l'évidence qui sort des autres pays et ici au Canada, de quoi on doit suivre, qu'est-ce qui va changer. Alors, on n'a pas une date exacte où ça peut changer et on va voir. Alors, j'espère qu'il y a des choses qu'on va changer et puis j'espère qu'on va garder quelques-unes des mesures.
Merci beaucoup.
Merci.
P.E.I, The Guardian.
Hi, good afternoon to you both. I apologize if this might have been asked in French. I might have missed it, but the gatherings, I guess, in phase 1 and phase 2, up to 5 outdoors and in households, do people still need to maintain social distancing? Like, are hugs legal, I guess, in phase 1? You know, is that permitted?
So, hi, Stu. The physical distancing is really important. So, and in phase 1, it's really about outdoor gatherings and still maintaining that distance. But it's about the fact that we may be able to. I could take one of my children, and we could go visit and go for a walk with a friend and their daughter, so that the 4 of us could go together. And that's something that we haven't been able to do. The second phase, when we talk about 5 people in one house, perhaps 2 people could go visit another couple and at their house, but still maintaining social distance. So that is really important, and it's part of that doing things gradually and trying to protect yourself and the other people.
So hugs, not yet?
Not unless it's with your own household.
Okay.
Okay. I guess second question, just why the 3-week intervals between, I guess, the first, second, and third phases? Like why, you know, some provinces I think might be going with a 2-week interval.
Right. And that's a good question, Stu. So the input really also came from our provincial epidemiologist and from the EPI team. So when you look at how long the incubation period is, when they may present with symptoms, and then seeking care and testing, we felt that the 3 weeks was a reasonable amount. And you'll see, as you mentioned, there's some places going 2 weeks, some places going 2 to 4 weeks. And we felt that 21 days would give us a sense of seeing an increase in the number of cases or any outbreaks, and a chance to make sure that we had the capacity, public health capacity, if we had a large number of cases, making sure we had that in place to do contact tracing. So and again, if things change, that date will change, but that is based on what we know about the virus and its when you may present with symptoms.
And I think, Stu, just to finish up, that is one of the ongoing conversations, obviously, that we have, and a lot of the input that we get from islanders, whether you're an island family, a business, an NGO, is been around the timing. As I said off the top, as Dr. Morrison has said every day, there's no across-the-board answer that makes everybody happy or that doesn't bring forward discussion. But when we deal with things like 2 or 3 week increments and we look at the health component of this, we kind of just take it under that lens of those who think we could act more quickly. We can't say for sure that they're wrong, but we also can't say for sure that they're right. And when we have to make that balance and when we have to walk that line, we have a responsibility, knowing where we're at right now in the health pandemic process, that we have to err on the side of health and safety and caution. So would we all prefer we did this sooner? Perhaps yes, but we do have to err on the side of safety and caution, and we do have to start to ease up because islanders need that, and that's kind of what we're doing. So.
Okay, thank you.
Thank you very much, and thank you to all of our friends in the media. You're doing a great job keeping islanders informed and up to date, and I know tip to tip there's many islanders who are relying on these and other updates all day, so thanks for your great work. So thank you very much.